Hello, everyone. Thank you for joining us today. I'm Dr. Didi, Dr. Ndidiamaka Obadan. I'm the CEO and founder of Younger Self MD Medical Clinic Health and Wellness. We're located in Kennesaw, Georgia, and we help adults at risk prevent and treat medical conditions like diabetes, high blood pressure, and chronic kidney disease in as little as a 30-minute consultation so they can go on to live longer, happier, and healthier lives. I'm here with the amazing Dr. Anita Lwanga, who's going to introduce herself. I hope I didn't butcher your name, Anita.
Oh, no, it's perfect.
Please go ahead and introduce yourself to our audience.
Okay, well, I'm Anita Lwanga. I'm an internist, a geriatrician, and prior to going to medical school, my background was in exercise and health physiology. If I actually even back up further, as a child, I was a competitive gymnast, and I used to kind of experiment on myself in terms of seeing how food and how sleep would affect my performance. I noticed when I didn't sleep very much, my performance was not good. And if I didn't eat enough, of course, my performance was not good. So I started to kind of change the way I treated my body, and I noticed my performance changed. So I decided to do exercise and health physiology under the umbrella of kinesiology. And during my studies, I learned a lot about how exercise impacts your body, how even different kinds of exercise can impact, say, your cardiovascular fitness or the way your muscles grow. And I also had a little bit of training in nutrition. I think I ended up taking about 1 year's worth of nutrition courses. And I realized what I was doing as an athlete was actually probably not the best for myself. So I use a lot of that knowledge even today in terms of the way I counsel my patients. Of course, in medical school, we learn about the pathology, how the body, how things can go wrong in the body. And we also learn about medications to help fix the body, but we don't, I don't know about your training, but in med school, I didn't talk much about nutrition. And same with residency, we didn't talk much about nutrition. So I kind of incorporate all my training to help my patients.
That is amazing. That's a lovely introduction. I did not know that about you. The kinesiology part of it. And oh, that's so you were a competitive trainer. What did you say about your competitive sports?
Gymnast, I was way, way,
Gymnast.
way back. Yeah.
Oh, wow. That's great. That's so cool. So, we're going to tell us a little bit about your story. Like, why did you decide to go into the field? So, you mentioned that you're a geriatrician, and for people who don't, so I'm a nephrologist. I'm a kidney specialist. We're both internists. So, I always try to explain to people that internal medicine, it's like the basic, is the general degree when you finish your residency, right? And then you go on to subspecialize in other things. So you subspecialized in geriatrics, and I did a subspecialization with a little bit more number of years in nephrology, which is the study of the kidney. So tell our audience what geriatrics is.
Geriatrics is the care of adults that are 65 years and older, if you're using the formal definition. But to be honest, I think we probably both know people that are younger than 65 and they seem to be a little bit older than that. And I'm sure you've met people who are in their 80s and they do not functionally look like a typical 80-year-old. But in general,
Right.
yeah, there are a few issues that people tend to face as we become wiser. Things such as memory loss become more common, falls, and then even in terms of managing the medical problems, individuals tend to have more complex medical problems, and sometimes the medicines that we as doctors give them cause more problems, don't improve their quality of life, and actually contribute to earlier mortality. So as geriatricians, we tend to look at the patient as a whole, not just their age, but their functional status as well. And we work with their other physicians to make a plan that's appropriate for that patient. Our goal as geriatricians is not necessarily to prolong life, but to make sure people have good quality of life and their goals of care, meaning whether they'd want CPR, whether they want to be on life support, are clear to their family members and to them before they end up in a situation where it's very difficult to make that decision, such as when they're in the hospital. So it's a Well, I liken it or compare it to almost like pediatrics because the children now become the parents. You're talking to the patient and then you have to call their children and explain stuff because sometimes they don't remember. So it takes a lot of patience, but it can also be very rewarding.
Yes, it is. It's very rewarding. I come across a lot of the older population as well. And, they are, I like the analogy you gave with the pediatrics because they're kind of their own special population. And as you mentioned, there are a lot of things that are frequently affecting them, specifically like the memory issues and falls, which is a very big one. So,
Mhm.
but I want us to go back. Tell us your story. Like, why did you decide to become a geriatrician?
Wow, that's it's a little bit difficult to answer. I think to be honest,
Well,
to be
okay.
yeah,
Why?
to
Why
be
is it difficult to answer?
because I feel like the way life happens, you have your own goals, your own thoughts, your own perhaps naive perceptions of what you're getting yourself into. So even with med school, I'm like, I don't really think I knew what I was getting myself into. You go through med school, and then at least for me, I was like, I don't know, I like pediatrics, I like everything. I like radiology, I like this, I like that. And when I was going for interviews, one of my friends was like, focus, like you can't be all over the place. Pick one. So I picked internal medicine to be honest, because I was like, I can change my mind. You're not stuck. You can pick any specialty.
Yes.
Yeah, and the funny thing is, even during med school, like I did a geriatrics rotation, and I'm like, I like the kids, I like the older people. Like for some reason, I tended to connect better with them. So after I did my internal medicine training, to go back to Canada, you have to have like additional fellowship training, and internal medicine training is a little bit longer. So I chose geriatrics as like an extra my fourth year, and things worked out very well. Like I was in a nice program at UIC. My attendings were so kind and so compassionate and just great role models. Like they really taught me the difference of like, looking at the patient as an individual, not just saying this is a geriatric patient. Like we'd have
Yeah.
90 who are functionally 60-year-olds. Like I remember two in particular, like one who was playing basketball. I'm like, what is this? And they're like, no, you do not, treat that patient like a typical geriatric patient. You want to be more aggressive because, they have functionally, they're not a geriatric patient. And then
Correct.
occasionally come to the clinic that's just 60. They're not a geriatric patient, technically, but functionally they are. So I just really had great role models and great attendings, and that's what made it rewarding. I don't practice only geriatrics because, as you know, as a nephrologist, you have such a wide breadth of knowledge that you can pick up anything that's not nephrology related because you have the training in that area as well.
Yes, and that's why I decided to still maintain my internal medicine knowledge, still to stay in touch, even though I'm a nephrologist, because yes, I want to focus on the whole body as a whole, just as you mentioned. But that is amazing, So I like what you mentioned about focusing on quality of life rather than just prolonging. I want both. I want people to stay healthy. I want them to live long, and I want them to be happy in the process. And that's my definition of prolonging their quality of life. And you keep, so back to exercise. Let's take us back a little bit because I feel like this is one of the things I tell my patients. I always emphasize on the exercise physiology. I mean, everyone talks about lifestyle changes. They talk about their adequate nutrition, but let's delve in deeper. You know, Tell us some tips that we can share with the audience on why it is important for us to exercise.
I like that question. That is a great question. There's so many great reasons to exercise. The classic hear about why it's an exercise is that it's good for your heart. It helps you maintain your cardiovascular fitness. It helps you keep your lung capacity functioning. It helps you maintain your muscles. So not just cardiovascular exercise, but doing something like lifting weights or calisthenics, which is using your body weight to do things like push-ups or lunges. That helps you maintain your muscle mass so that as you get wiser, you're less likely to have falls. On top of that, there's been so many studies that have shown that exercise is good for your skin. For those ladies who are into like making making sure that their skin looks great, it's very important to exercise. They found that people who exercise 30 minutes per day are more like their skin actually looks younger if you look at it under a microscope. Exercising also improves your quality of sleep. As you exercise, I don't actually have all the physiology or the proper explanation, but I'm sure you notice if you burn more energy during the day, you sleep deeper, so you have better quality sleep. On top of that, exercise has been shown to improve your mood. So if you suffer with, say, like seasonal affective disorder, or you're just not feeling as excited or happy, if you exercise, your body releases endorphins, which are like a natural hormone that gives you a high, so you tend to feel better, your mood is better. They've also done studies on people that have psychiatric disorders such as I think bipolar, schizophrenia, depression. They tend to have better outcomes if they exercise. So I tell my patients, though I can't necessarily prove this, but exercise is the magic pill we're all looking for. For some reason,
Maybe
most of
I agree. I agree with you 100%. And, exercising is the magic pill that we are all looking for that is going to keep you younger, and it's going to do what you've been saying, make you look like you're in your 60s when you're 80 years old and still have everything working because you went from the head to the toe and you talk about all the different benefits. It affects every single system. Most importantly, your mental health, your memory, your mood, and all the other mental health disorders that can come with, not exercising appropriately. So yes, it is the magic pill. But people find it so difficult to get involved in a regimen, and it's difficult this is the complaint I get all the time, right? It's hard to start and maintain your regimen, and they don't even know like how intensive their exercise regimen should be. So what tips do you have to share with them for our audience to get them to love exercise? And I always try to counsel my patients to get addicted to exercise than other bad habits like alcohol and those other negative habits that people tend to get addicted to. How do you
absolutely.
what are the steps that they should take to start?
I can totally relate to that because despite my background, to be honest, I think during med school and residency, I didn't exercise. I thought I was too busy. I think most of us did not.
But yeah, I mean, but what are we talking about here? We're not saying that you have to just dedicate the whole, day to going to the gym. It can be as little as, right, just being active for 30 minutes, 3 times a week, walking briskly, going to the park. I feel like you can incorporate exercise with everything, with your daily activities. For example, you know, standing having a standing desk at work. That's what I tell people. Go ahead. Those are some
Yeah,
of the,
absolutely.
the tips. Yeah, go ahead.
I wanted to say that because I wanted to say I can relate to the struggle. But once you get into the routine, it's much easier. So some of the things I've used in my life to make exercise easier to incorporate are pairing exercise with something else. So looking back, I
Right.
actually love watching Netflix and like whatever I was watching on I think Amazon TV. I noticed towards like when I was doing my fellowship, if I took my iPad up and was watching Amazon TV within like 2 hours, I had been walking and I didn't realize. So if you like watching TV, there's a TV show you like binging on. Get yourself in front of the treadmill or in front of the bike and watch that show. And don't let yourself watch TV or, binge on whatever unless you're doing a physical activity. Another way to pair your exercise with something else you like, if you have a morning routine, for example, like a morning prayer or meditation routine, my nutrition coach, his name is JT Tapias, actually taught me this. He said, walk while you're praying in the morning. So I really like doing that. Like the first hour of my day, I'm actually drinking coffee, like trying to wake up and like climbing the stairs to get my going. I'm getting my cardio in, and then I'm listening to positive podcasts, do my affirmations. So if you compare it with something else that's already part of your routine, it can be very easy. You can walk to work. If you're in a place that's warm enough to do that, you can walk to work or bike to work. Ideally, the current guidelines recommend exercising 3 days to 6 days per week for a minimum of 40 minutes to 1 hour. It's very difficult to over exercise. Most of us don't get that in. But as Dr. Didi was saying, if you can stand, if you can take the stairs in your building, park as far away as possible from the building that you're in, you can add in extra steps. But ideally, you want to have a block of time closer to 1 hour. 3 days a week, that's not very difficult. And just force yourself to go. If you have a pet, you need to walk that dog. So add it in that way. Walk
Yeah,
groceries while and have a point system. If you need to bribe, I've used that too. If you need to bribe yourself, bribe yourself. I've had like a point system where if I hit a certain milestone for the month, I get to, buy something. So if you have to gamify it. There are ways to get it done and get it into your schedule.
I agree. I mean, those are all great tips. Thank you for sharing. In fact, that's way more than we wanted three, and she went above and beyond, and she gave us like 100. That's great. Thank you so much, Dr. Anita. And what I was saying is, if you don't, the goal should be 1 hour, right? But to start, sometimes people are so reluctant. So even if it is just doing a little dance while you're brushing your teeth in the morning, like you said, pair it with things that you really enjoy, right? And start small, start about 5 minutes a day, and then work your way up. The goal is to get to where you're doing it consistently for 1 hour. So yeah, those are all so many great tips. So thank you so much for sharing. So let's move on to the next. Oh, look at the time. We're having so much fun, and it's almost coming towards the end of our podcast. So share with us something interesting that happened to you recently, or something you learned that made you feel empowered.
Wow. Wow, where do I begin? There's so I feel like every day I am learning so many things. But I guess maybe the best tip I can share with people is that whatever goal you have, you can achieve it. And I think the wise way of achieving it, or the shortcut way of achieving it, is to get help. Um, so just going back to what Dr. Didi was talking about, you were talking about, like, how you give your patients tips in terms of exercising, and even this podcast. People who are listening, you'll find a tip that you like and you want to apply to your life, and it'll be such a simple tip, but it can make such a big difference in your life. So just my own story. After finishing residency, I actually had the opposite happen to me. I gained a lot of weight despite trying to exercise, because I was exercising the wrong way. So I got a nutrition coach, and within a few months I lost a lot of weight, and I was like, this was not hard. Like, why was I stressing myself? And just that connection with that one person really made a big change in my life in terms of the outcome, without really disrupting my life a lot. Like, he actually enhanced my life, even telling me, you need to sleep more. So if there's something you're trying to achieve, try and get a coach, try and get somebody to help you, and you'll expedite your process, and you won't have to work as hard. So to me, that's been, I think, the biggest lesson in the last probably 8 months. Find the right connections, get the right help, and you can really expedite your process.
That's amazing. That is so good. Thank you so much. And so it's so I mean it resonates with me as well. Because we all need accountability partners. I always say, so I created this campaign, Get Mad About Saving the Kidneys. And MAD stands for movement and mindset, fixing those, which is pretty much getting the exercise regimen in place. And the A in my MAD is accountability. And I tell my patients that, just as you said, Dr. Anita, it could be as small as getting your spouse or your kids on board, or your family members or your friends on board, to keep you accountable for the goals that you set, or getting a coach, getting a coach to help you get back on track. We all need some form of accountability. The D in my MAD campaign is diet. So, that's we'll talk about that in the net when I have you back on the podcast the next time, so we can go delve deeper into the nutrition aspect. But this has been so good. There's one question I wanted to ask you. You mentioned that you were exercising wrongly when you started adding weight? And I was like, I need to hear more about that because I didn't know that. What do you mean by that? Can you, do
Wow.
you want to share with us?
I'm glad you asked that question because there's still so much more I want to say about exercise, but I'll keep it to that and we can talk next time. So I was exercising in a way that spiked my cortisol level and made me more hungry. So I ended up eating more and I was probably choosing the wrong foods. So I was doing a lot of what we call high interval intensity training. So when you look at the way we do exercise or train, there's what we call low intensity, which is walking, and you have to do that for a longer period of time to burn calories. You'll eventually burn calories, but because you're going at the slower, lower caliber, you burn more fat as your fuel source rather than glucose. And you're not putting your body under stress. So you're not spiking cortisol, which is a stress hormone, and you're not increasing your, I think, growth hormones. And there's different hormones that are involved when you do those high interval intensity workouts. So I was working night shift, and that's another thing. My sleep was not as good as it should be. So my cortisol level was up. I was doing this high interval intensity training for like 30 minutes to 1 hour before my night shift, went on the night shift, and then I was very hungry and eating the wrong foods. So I
Mhm.
switched now and I do primarily walking, or sometimes I don't even work out very much. And I'm not hungry. I'm working out, but working out in a way that's not spiking my hunger hormones. So that's what I meant, but I was doing the wrong workouts. If you're gonna do
Got
HIIT,
it.
it'll help you maintain and build muscle, but you do not need to do it more than 2 times per week. Otherwise, it's like you're kind of making yourself go backwards because your body can't recover fast enough and you're going to be hungry all the time. So that was my big mistake.
Yes. And, as a nephrologist, I really, a kidney doctor, when you exercise intensively and get dehydrated or develop a breakdown of your muscles, rhabdomyolysis, those are the consequences for doing the excessive heat training, and it can definitely affect your kidneys as well. So I mean, this is something we warn people about. Like, you have to, before you start those intense regimens, make sure that you are evaluated by your physicians so that they can clear you. Make sure you don't have any cardiology issues, heart issues, and your kidneys are intact. And they'll counsel you on how to stay hydrated. But that was good. That was good. Thank you for sharing that with us. We also have to be mindful about the consequences of exercising wrongly. Yeah. So well, Dr. Anita, this was so good. How can people find you if they want to work with you and learn more from you about your exercise tips and your nutrition tips?
Well, on LinkedIn, I'm Anita Lwanga. The last name is Lwanga. On Instagram, I tend to spend more of my time on Instagram. I'm at Dr. Lwanga. Doctor is just Lwanga MD, Lwanga MD. That's all caps. On YouTube, you can just search Dr. Lwanga. On, I think it's TikTok, it's Dr. Lwanga lowercase. I haven't been as active there lately. And on Twitter, I think it's at Dr. Lwanga. I might have all these handles wrong. It's like hard to keep track of all of them. So
Yes,
hopefully,
we'll put them in the comments and the notes so that everybody can find you easily. Well, thank you for being our guest. And it was you can find us at youngerselfmd.com, and we're accepting patients. We're also on Instagram at youngerselfmd, and our YouTube channel is youngerselfmd. So we're currently accepting patients, and we would love to take good care of you. And until next time, stay tuned for our next amazing guest. Who's it going to be next? You have to join us to find out. Thank you so much, Dr. Anita. This is so good.
thank you so much for having me. I appreciate you taking time out.
Bye.
Bye.
Where's the stop button? Oh, there it is.